Yes, Patrick, there we are. Hi, nice to have
Hi,
you
Jeroen.
in our
Good
show.
afternoon.
How are you?
I'm doing well. How about yourself?
I'm good, thanks. Sorry for a bit of a delay, but it looks like I had a wrong walk to my chair, but it's just next to me. We had some fine tuning for the viewing. So let's go, I would say. You're based in the Netherlands, right? At Eindhoven, if I'm right?
Yeah, I'm based at the high-tech campus in Eindhoven.
Perfect. Before we kick off, as I said, I had to read out loud your whole function title. Could you please introduce yourself a bit? What's your daily work consisting of?
Yeah, so I'm now in my fourth year working here at Philips. Prior to that, I worked for Medtronic, so same domain, also medical device industry and healthcare. And today, me and my teams, we're constantly looking like how can we join the digital transformation in healthcare. We all know healthcare is suffering from quite some problems, where the biggest problem is definitely shortage of staff. And a lot of answers can be found there in digital transformation. How can we reduce mundane tasks? How can we optimize the workflow? How can we optimize procedure? So our teams, we are not in IT. As you said, we are an innovation and strategy, which is a service organization that supports multiple businesses in Philips to see how we can support them in accelerating the innovation journey in the field, well, in my space, then in data science and AI. So we're mainly focused on the clinical space. So we're mainly dealing with our external customers and the hospitals and the patients. But that said, we're also doing, of course, a lot of internal projects. But my teams are not involved like, hey, how do we optimize our supply chain or the finance figures or doing any reporting or supply chain on that. We're really focused on the clinical space.
And is there, in the end, the main goal of you and your teams to improve the care, well, basically you and I get in the hospital or when we are, ill?
Well, let's start making sure that you at least can go to the hospital. So let's start with elevating the access to care. So if we can optimize the procedure and the caregiver has to spend less time on the procedure itself, more people can get access to care. Think about underdeveloped countries where care is not as obvious as it is for us here in the Netherlands. How do we make sure that those people get access to care? So access to care, optimizing the procedure, that's one big goal that we're looking at. Then secondary indeed is how do we then indeed improve the procedure to make sure that we indeed, through the usage of AI, get better insights on what we actually see on the images and with that can do better detection of early diseases.
Yeah. Patrick, we're very happy to have you here because you're going to, take us as far as possible on the journey that you at Philips are on in this respect, balancing digital and AI transformation. To start off with the question, the key factors, according to you, aligning AI and digital transformation, what are the key factors in order to succeed in this?
A big movement that we see at this point taking place at all of Philips now is we change our operating model and we call it now business-led. And what we do now, in contrary to what we have done in the past, is really like every initiative that we work on, we need to see that coming back in a strategy of a business. Where Philips, of course, has a rich history of innovation. And I think we were recently called out again as one of the companies with most patents out there. We are really trying to focus now because innovation, can be very broad, especially if you go into the digital innovation, it can go any side and any way. So the focus is really important, and making sure that we work on those initiatives that truly have a meaningful outcome is something to look at. And then when we look at AI, of course, I think over the past few years, we have more AI specialists than ever were born on Earth there. So we also see a lot of hype around AI. And so how do you distinguish that? And looking at AI adoption, we see at one side fear, we see at the other side, we see bias, we see a lot of roadblocks that are hindering us from going there. So that's also where we say, like, let's look at the different levels, what we can do. So you immediately started, as many people start, like, hey, how is AI going to improve my health and make sure that we get better outcomes? But if we start with, getting access to care, take a simple example. The Bill and Melinda Gates Foundation, they had a wish that every woman on the world that's pregnant should get an ultrasound. Okay, that's a very difficult task, because how do you get access to all of that? And even if we would have all the equipment, training someone to do a good ultrasound of a fetal can easily take, 6 to 8 months to get that done. So they came to us and asked us, like, hey, how can you do that? And of course, we do that with AI.